Yes.
Our knee joint takes most of the weight of our body and is formed of a structure which is covered by cartilage here on this bone, which is the thigh bone or the femur, and similarly on the top of the leg bone or the tibia. This joint can be divided into the inner part, which is the medial part, and the outer part, which is the lateral part, and the front of the joint, which is the patellofemoral joint, and this is the kneecap or the patella. So it has got two condyles or two parts of the joint, the inner part, which is the medial part, the outer part, which is the lateral part, and the front of the knee, which is also called the anterior compartment or the patellofemoral joint. Normally, arthritis or wear and tear disease of the joint starts from the inner compartment or the medial compartment. Gradually, it spreads to the outer compartment and also the anterior or the front patellofemoral compartment. The starting symptoms of the patient are pain on the inner side of the joint, some swelling on the inner side of the joint, difficulty in walking for long distance, and patient can also have night pain. When the symptom is limited to the inner compartment, we give treatment in terms of physiotherapy, certain medicines which help reform the cartilage surface, and advice to reduce weight. These all can help in relieving the pain of the patient and reducing the arthritic process of the knee joint. But if the cartilage gets totally worn off or denuded and the bone hits the bone, then generally conservative treatment like exercises and medicines do not help, and the patient has to undergo some sort of intervention for pain relief. When the disease is limited to the inner compartment and the ligaments and the rest of the knee is normal, patient can be given an option of partial knee replacement. Now, partial knee replacement means that we change only the inner part of the layer of the joint, and the outer part and the front part remain the same, and the ligaments in between also remain the same. So this is called partial knee replacement or medial compartment knee replacement or unicompartment knee replacement, in which only the inner side of the layer of the joint is changed, the rest of the joint is normal. Normally, the hospitalization for a partial knee replacement is 1 or 2 days, and patient can regain full normal activity within 15 to 20 days and can then enjoy driving and full function and full movement because both the cruciate ligaments are normal. Generally, the longevity of this implant is between 15 to 20 years as published in our literature. If the patient has severe arthritis, that is, the inner part is damaged and destroyed, so is the outer part and the front of the knee, and the patient is not getting relief by medicine and exercises, then knee replacement is indicated. Knee replacement does not mean that we put in a new knee. What it actually means is that we change the surface of the knee on the femur bone and the tibia bone, roughly 8 to 9 millimeters here and 8 to 9 millimeters here, and in between is a high density plastic. This knee is made of alloy of cobalt chromium, and this is high density polyethylene or plastic. Current generation knees give very good movement up to 130 to 140 and last anywhere between 20 to 25 years. I perform this operation using computer navigation so that the alignment gets corrected, because most of the knee arthritis patients have got severe deformity and it is important to correct the alignment accurately. It's also important to use the best quality implants so that our results are good and long lasting. Generally, if the patient is medically fit and if both the knees are damaged, then we can perform what is called bilateral knee replacement or both the knee replacements at a given time, at the same time. If the patient gets operated for one knee Generally, the hospitalization required is 3 or 4 days, and for both knees, anywhere between 4 to 6 days. The patient can stand up on the same day after the knee replacement surgery and walks a few steps on the next day and walks more, almost up to 50 to 100 meters on the following 3 to 4 days. The patient can climb stairs 2 to 3 in the first few days and then gradually more steps at the end of 15 days. The patient can walk independently without any support at 15 days and can do and regain full activity at 4 weeks. After knee replacements, patient can enjoy walking, standing, driving, going up and down stairs, and also sitting on the ground cross-legged. Patient cannot really truly squat Indian style toilet, but can sit on the ground comfortably sitting cross-legged if their spine and hips allow. It's advisable that patients walk regularly and also cycle on a stationary exercise cycle to regain full movement after knee replacement surgery. There are certain theoretical risks after knee replacement surgery which are reduced by getting the knee operation done in modular theatres with full infection-free environment and proper post-operative care. The main risks are, one is infection that can be reduced by taking care of diabetic status of the patient, getting the surgery done in modular theatres and using space suits. The second risk is of venous thrombosis, which is formation of a clot in the legs for which we give blood thinners so that patients do not get any venous thrombosis. Practically speaking, knee replacement today, even both knee replacements together, is a very safe surgery and the patient can be free of pain and deformity and enjoy full form and function.